A doctor says Indiana's largest hospital engaged in dangerous practices and put pregnant women at risk. When Dr. Judy Robinson worked as a medical director at IU Health Methodist Hospital, she says she discovered lower-paid midwives were in charge of overseeing high-risk pregnancies. She says they did not have proper physician supervision, leaving some patients with what she called, quote, substandard care. Alex Ferrer, a judge, former police officer, and host of the CBS series Whistleblower, spoke to her about what she says was an act of dangerous insurance fraud.
Dr. Judy Robinson has brought some 3,000 babies into the world in a career spanning over 30 years.
I get to participate in the most important day of a person's life, the birth of their baby. When I was in private practice, I delivered people's second and third babies.
But Dr. Robinson felt unfulfilled in her suburban private practice. She wanted to do more for those with less. So she took a position at HealthNet clinics, then affiliated with Methodist Hospital, which catered to low-income, disadvantaged women.
I feel like I'm making a difference. Typically, the patients I oversee were very high risk. They had multiple medical problems associated with their care.
Dr. Robinson had been looking forward to working with a team that included a well-respected group of midwives.
The typical role of a midwife, in my mind, can be a tremendous asset to any practice because he or she can practice obstetrics in a low-risk, normal patient population.
In Indiana, Medicaid rules say midwives can take care of normal pregnancies, but the rules also say there should be physician involvement when a pregnancy becomes high risk.
So you absolutely need to have that physician backup, no matter what.
But Dr. Robinson says that's not what was happening at HealthNet and Methodist Hospital, a practice she says had fatal consequences for this young mother.
Tanae Tyler had medical problems that were considered high risk.
It's a struggle every day that I wake up and know that my daughter's not here.
If they had listened, if they had brought physicians in, I can't help but think that Tanae would be here today.
A result, according to Dr. Robinson, of the tensions at HealthNet clinics between midwives and OBGYN physicians.
It was a midwife practice, and we were not to intervene in a patient's care unless we were asked.
A point that was forcefully made to Dr. Robinson by the head midwife.
She put her finger right in my face, and she said, "This is a midwife practice. Don't you physicians dare try to take care of these patients. The only time that you're going to see a patient is if I tell you you're going to see a patient." People were being harmed, and it needed to stop.
Now, in a statement to Whistleblower, IU Health Methodist Hospital and HealthNet both deny any wrongdoing. Alex Ferrer joins us. Alex, good morning. What's the motivation behind putting patients in front of midwives in the first place?
Well, in this situation, like in most of our whistleblower cases, financial. I mean, all our cases really are about corporate greed. And if you have midwives who are being paid considerably less than doctors, and doctors who are being reimbursed at a much higher rate by Medicaid, you have a situation where midwives are being used to treat high-risk patients, which they're not supposed to be in care of. The doctors are supposed to be in care of them. But the doctors were being billed to Medicaid as if they were handling the patients when they had little or no involvement. So you had some tragic circumstances. Tanae Tyler's one example of that.
But what happened to her baby?
Well, it's what happened to both of them, actually. Unfortunately, her case was every parent's nightmare. Tanae went through labor. Her mother was told, the baby and mother are fine. You'll be able to see them soon. And the next thing you know, Tanae died. And her baby was born with cerebral palsy. It's believed that it was as a result of substandard medical care. She is one example. Dr. Robinson documented many examples of where midwives were involved where she believes they should not have been.
Hard to watch, but important subject. Alex Ferrer, thank you very much. You can watch Whistleblower, Doctors versus Midwives, Dangerous Deliveries tonight at 7 Central, right here on CBS.